joined the military back in the early 60s, there have been drastic changes. For example, improvement in health care, the coordination of that health care, looking at the access of that. And also, having been in the military, it's being transparent and sending people to the Department of Veterans Affairs for health care or working with other agencies. And the key thing that I like now is that there's coordination and collaboration, looking at quality of care, looking at health care, looking at all the things that impact women. So what we really want to do is use the research work from all the agencies, come together and talk about it, and accept the best practices to improve the quality and the life of women in the military and when they become veterans. So.
One of the things that we recognized early on that, Department of Defense is a big department. And to say that we care about and we want to foster research in women's health, and we want to be sure that women across the gamut, all age groups as well as all racial ethnic groups, various social economic status, to say that we care about them meant that we just don't go to one organization within DoD. We have to go across all of the services and all of the organizations.
There are some differences with regards to women's health care in the military compared to civilian populations. There are advantages and some disadvantages. And so it's important that we articulate those and talk about those. There are many advantages to being an active duty woman, but there's also some aspects we need to discuss in terms of special risk factors that are important to bring out in a conference like this.
The most important thing that's being accomplished already, and I was very impressed with the first session, is getting the issues on the table. There are a lot of questions. We need research, and we need to be able to prioritize which research we need and why.
Research for women's health is critically important because they are almost a quarter of our military population. The military is such a unique organization. We are the nation's example of what universal health care entails. And it is truly my belief that if you take away some of the biases that come from people not having health care, you can have a great idea of how to best serve people, how best to decrease health disparities amongst different groups.
I think that to make sure that people understand that women's health in the military is a critical issue. It's important for readiness. It's important to provide adequate care to what's upwards of 20% of the military health population. And these are issues that if you don't focus on them, tend to be overlooked. So I think bringing this group together at this place, at this memorial, has both a powerful symbolic intent, but also a very powerful practical intent.
I leave today inspired with just the collaboration, the caliber of researchers, the caliber of those who serve, and how they are serving